name is Monica. I am a second year in the respiratory care program. We took our first years through a couple of clinical-based scenarios to prepare them for their first clinical rotation. First year students, a lot of times, bridging the gap between in-person or classroom-based stations and clinical application can be a little bit difficult. What you learn in a classroom doesn't always translate to a hospital setting and an actual patient. So these cases were designed to kind of stimulate them and get them thinking about their patients as a patient and not a textbook case. So getting them comfortable with assessing their patient and determining if their therapies and the medications are appropriate, if you need to de-escalate or escalate your care. Yes, so this is part of my capstone project. As a now second year, we remember the nerves and the anxiety that came with our first clinical stations. So this program is supposed to provide them with more confidence in their skills and in their competency, so they start their rotations with more confidence and are a little more sure of themselves. Each station was developed after a certain set of competencies that are expected for us to develop by the time we graduate. Those competencies on paper sound really nice, but sometimes carrying them out can be a little bit more difficult. So these stations were designed or developed to kind of test those competency skills and see if they could actually apply them. When I have my undergraduate degree in biology, and I went through a year of not really knowing where I wanted to go with my degree, and I attended to different open houses, but Dr. Rojas, Dr. Nastaris, and Sachin at the time, they were my interviewees. They spoke with such passion regarding respiratory care, and they have a large plan for the field in general, and I wanted to be part of that. I wanted to be part of a field that's growing. I just want to be able to contribute to that, kind of the legacy that they're establishing here at UTMB. I was hoping to boost the first year's confidence to make sure that they hit the floor running once they enter the hospital. As a second year, they did pretty well. The skills are there. They just need to dust it off. They need to dust off the cobwebs because they're smart. They're intelligent. They know their stuff. They just need to get kind of out of that bubble and be comfortable performing the competencies. UTMB is great when it comes to applying students' concerns and their ideas. We can give feedback, and the program takes that and lets us grow from there. Prime example is this bootcamp. I felt like there was something that I could do, and Dr. Rojas, Dr. Nastar, Dr. Lee, Sachin, and Bruce, they allowed me to kind of make it my own and gave me the space to grow what I believed was something that needed a little bit more help.